we think we can reduce the amount of phone calls, manual intake forms, that manual chart review effort by 60-70%, right? So, and then what you do with that savings is kind of up to the health system, right? Maybe they can keep utilizing those staff and go deeper with patients and actually focus on, better support, or maybe they can actually have those people do more, hands-on patient care.
Welcome to Austinpreneur, our show about the stories that made Austin, Texas a global hub for startups. The show is produced by Capital Factory and hosted by me, Nick Spiller. As a reminder, by joining Capital Factory, you can plug into the ecosystem where the stories on this show were set. Learn more about us at capitalfactory.com. Awesome. Sweet. Well, welcome everyone to the Austinpreneur podcast, where we talk about the stories creating innovation here in Texas. And we're here for some very special episode at Health Supernova 2025 at Capital Factory. That's Capital Factory's cornerstone health innovation event. And we're kicking it off. I think this is the first session. It's bright and early. Probably we're setting a record for the earliest recording of our podcast ever. But we have a full room and we got some awesome people. And we have a very special guest who I've known for a few years now, and we're thankful to be investors in his company, Orchestra Health. This entrepreneur came in from San Antonio, Texas. I call it far South Austin. And he's trained and spent a lot of time as an anesthesiologist. Went to UT Health and did postdoc at Stanford. He's now the chief medical officer at Orchestra Health. And he has a partnership with UT Health we're going to dig into a little bit as well. And we're going to talk about working with health systems, raising money, and whatever else that comes up here in the next 45 minutes to an hour. So join me in welcoming Stu Solomon to the show. Stu, thanks for being here.
Thanks for having me.
Yeah, bright and early. How are you?
We're kicking it off. Health Supernova.
That's right. You've been to Health Supernova before, right?
I actually don't think I have.
Your first time. Wow.
Yeah. There's the last couple of years it's been in Dallas.
Right.
Right.
A little farther drive.
A little bit. So excited to have it here in Austin, and
we are too.
Yeah.
Yeah. We're on home field turf. This event started in Dallas, and we hosted at a really incredible biotech innovation center. There's a bunch of different groups there, and but just we felt like bringing it to Austin would help it grow. And frankly, we think a lot more people will fly in and come visit Austin than Dallas. No offense, I love Dallas. I like to go to Dallas, but that's my personal opinion. But anyways, let's dive right in. So the topic of the session is startups and health systems unite, and I want to make sure we dive right into that. So you're working with UT Health. Can you give us a little intro on the nature of that relationship?
Yeah. So, and I guess first, just a little background on Orchestra Health.
Sure,
and what we do. The core of Orchestra Health, the idea behind what we're building, is delivering patient context. And what that really means is being able to understand what's going on with the patient at the right time that can tag into clinical operations and then deliver whatever the next step is in a patient's care journey. And the first model where we are delivering that is around surgery. And this is something that is very much my domain expertise as a clinical anesthesiologist. But throughout my career, I've been very focused on the logistics side, the operations side. Whenever I say operations, I always mean logistics and not surgery. But there is it's a very complex cascade of things that has to happen in a very short period of time. And the variables of the patient really determine what you have to do in order to achieve a successful and a safe surgery. So, speeding right up into the work we're doing with UT Health. UT Health, obviously a big, one of the, if not the biggest healthcare organization in Texas, but one of their areas of focus is in San Antonio, and they just opened a new multi-specialty research hospital. And one of the taglines for that hospital is the goal is for them to become the smartest hospital in South Texas, right? And delivering that tertiary care to patients that, may have cancer, complex surgical problems, have a lot of medical problems. And the level of coordination that's required in order to achieve that around surgery is really challenging.
What does that look like to the health system when they say, smartest hospital? Like, what are they looking to bring to life there?
Yeah, so throughout, I've kind of been in a bunch of different places throughout my career. You mentioned I spent some time at Stanford. I've seen some like big ivory tower type places. Also done a little bit of stuff in private practice where the resources are much more limited.
Yeah.
And what I had always seen is in order to solve this problem, you have to utilize a lot of staff. You have to hire people, nurses, medical assistants, calling patients. It's a lot of that manual labor in order to drive the next step. And, I think one of the goals of when you think about what does a smart hospital look like, it's, can we utilize a lot of these tools that have developed over the last couple of decades, things like automated patient engagement tools, being able to risk stratify patients automatically without having to, call them and confirm data, right? And then I think, in this day and age with a lot of the economic pressures of running a hospital, you want everybody working top of license, right? So you definitely don't want your doctors and your nurses calling patients, asking simple questions, confirming information that already exists.
You don't want them doing basic tasks. You want
Correct.
them to do the advanced things they went to medical school or somewhere else for.
And I think at the end of the day, if you can smartly utilize a bunch of these tools, sort of put it all together and put all those ingredients together in the correct way, it creates, number one, and this is something I'm really passionate about, having a safer experience for the patient. I think anybody who's had surgery, it's very common to hear about, why did it work this way? Or why was I asked this, thing a million times? Or why was this missed? Or why wasn't I told about this, right? But then that also keys immediately into the patient experience, right? Like feeling like everybody knows what's going on, everybody understands your care plan, and that it's actually a smooth process.
Interesting. I mean, from my perspective, it reminds me of the you have the consumer internet that came around, and we interacted with devices and software primarily through one device, your laptop, maybe your computer, and then we're now in the midst of the whatever you want to call it, Internet of Things, where everything is getting connected, and you're really going to that next level. It feels like hospitals are in a similar spot where it's like I think of just the starting point of electronic medical records and just getting that done and bringing it online. It seems like that was not the simplest thing to do. Now it's like the really taking that just digitizing everything and connecting it and I imagine the trusty buzzword of AI is right in the middle of all this stuff.
Yeah, I mean, and we could move right into what adoption of these technologies looks like. Yeah. And I think one of the big challenges in healthcare is, there's kind of this saying that healthcare is always 10 to 20 years behind what's going on in other industries.
Right. Yeah.
I do believe there's some truth to that.
Yeah.
I think of one example that there's a big hospital I worked at where they built a brand new, amazing, new $1 billion hospital. And they spent a ton of money laying, Cat 5 wire because they wanted everything to be wired. And then by the time the hospital opened, it was all cloud, right? So things like that where, you plan for the next decade, but you're often surprised what changes are going to affect your organization as a hospital.
So back to UT Health and Orchestra Health, so how they have the new hospital. It's going to be the smartest hospital in South Texas, potentially further. What are they looking to Orchestra? And I really want to get into how do you as an entrepreneur go through the process of working and developing a business relationship with such a large organization?
Yeah, so a couple of points there. So number one, our product and what we're doing at UT Health is we have two levels of service. So the first layer is, I mentioned that patient context. And what that really means when we look under the hood is we're able to pull all of a patient's medical documents, diagnostic data, unstructured data, things from like faxes, PDFs, data that exists on other EMRs. We pull all that data in, we sort of partition it, categorize it, clean it up, and then we are using some artificial intelligence tools that can summarize and generate that patient context. And what that does is it allows us to understand, what are the different categories of patients, right? Is this a low risk, low lift type of situation we're dealing with, or is this really complicated? Is this going to require more effort? And we can identify that at the earliest time point, so these things aren't happening in this sort of chaotic next step. And then the second layer of our product is actually a tech-enabled service. So, we can talk about what AI can and can't do, right? And, as a physician and somebody that deeply cares about patient safety, we're not at a time, I don't think, where we can have, agentic AI be telling patients, hey, you've got to go do this, you got to go do that. We know that it can hallucinate, it can make mistakes, right? So we do have people that are coupled with our technology that can take things to the finish line, engage with the patient when the automation doesn't take things all the way, right?
Yeah. And so you're supporting that, really the patient experience end to end as they go in to get surgery. And what does it look like to the patient? Like, how do they experience, and how is that better?
Yeah, and I've been working in digital health for almost a decade now, which feels weird to say, but I've kind of seen a lot of different patient engagement, patient journey models, and we felt pretty strongly that the level of engagement and the level of success that you can get with like an app or something like that is not was not the way to go. Yeah. So the way we handle it is, to the patient, it feels like the engagement is very natural, right? So text messages, phone calls, it feels like that sort of more traditional experience. What I always say is, I have some older folks in my family, and they're very, very smart. But if you ask them to download an app, just for a surgery that's going to be in a couple of weeks, that's not very many people are going to do that, right? But on the back end, and our software and our tracking tools, all of that is automated, right? So we can actually detect levels of engagement, we can escalate up or down, we can utilize different tools in order to reach the patient and kind of understand what the next step is.
And so who are the people at the health system that have been your champions, and where have you really been able to get people to engage you as a relatively new company?
Yeah, and that's always a really big challenge as a startup company, right? Is how do you engage with the health system? How do you get people to believe that what you're doing might actually work, and how do you actually implement, right? And our journey and our relationship with UT, obviously it's been very helpful that we are based in Central South Texas. So I'm on the north side of San Antonio, so this was kind of in my backyard, and had some relationships with people there. And then we have, team members in Austin, and, we're very active in this area. So there's, a story around that.
You're part of the community. You're already part of their ecosystem.
Correct.
To some degree. Yeah.
Yeah. And I think, to add a little more color to that, we actually started some of our early relationships with surgeons that operated at UT Health, and a lot of our early product development was developed with them. And I think through those relationships and taking some really bite-sized chunks of saying, hey, this is going to be free, this is going to be low lift, we're gonna do this thing and let's see how it works. And over time, the sentiment was, hey, this is something that we could maybe utilize for our entire hospital, right?
You ease into the relationship. It's kind of the large organizations have a disposition to distrust startups, right? And there's like, I see this, and it's just almost before, without really having an informed perspective, they will disqualify you unless you somehow immediately overcome this like, oh, you're just a little startup, you're not going to be able to go do something big, or it's ultimately, I think it's like people in the big companies, they're afraid it's going to make them look bad,
Yeah, I mean, we talk about this all the time, and by the way, I'm still leading all of our sales efforts, which is I never, as a physician, I didn't quite think I'd be doing B2B enterprise healthcare sales.
It should be taught to everyone. It should be taught to everybody.
But we talk about this all the time, right? When you build relationships with hospital administrators, they're worried about a lot of things, right? And they certainly don't want to stick their neck out to do a relationship with a startup when, one of the sayings is nobody ever got fired for buying Microsoft.
That's right.
Right? So, coming in and saying, hey, like we're going to take a chance on this, something new and innovative that's going to potentially change our workflow, especially something around surgery, which is kind of the revenue engine of most hospitals. It takes a lot of inertia to get over some of those humps. Yeah.
Right. But by one, just being a credible individual that they know just from being part of the community, being, a provider, and then the other key thing I heard is just a very low, if no risk way to get started and deliver some value. And if you can provide a no risk situation for them to engage with that does create some value that would catch enough attention, I presume, like to within the organization say, okay, well, we can maybe take a little bit more risk here and go grow it out. So over what time period have you been able to develop the, obviously you've been in San Antonio for a while and the relationships, but since you're actively trying to go put Orchestra's rubber to the road, how long does it take in and what?
Yeah, we're at about 2.5, I think it'll be 3 years at the end of the summer.
Yeah.
And when I look back at our journey and kind of our timeline, I would say that first 6 months to a year was really just developing the product and kind of just really getting those wheels starting to turn.
Right. And you were working with some like private practices,
correct.
Smaller surgery centers, or smaller groups before you went to the bigger.
Yep.
Yeah.
Yeah, and when we started, so we're 2 co-founders, the other half of our founding team.
His name is Austin, but he's not in Austin.
Yeah,
today.
no, Austin in New York City.
That's right, Austin in New York.
But he's a logistics software engineer, so cut his teeth at Amazon and shipping logistics.
Yeah.
So kind of the founding story was I brought a lot of the domain expertise and logistics background, and then he's a very experienced and talented software developer. And for the first 6 months, it was just the two of us, right? We kind of were just working off a spreadsheet and just kind of testing things out and seeing, hey, can this work? Got some early traction and positive feedback, and then kind of started to chip away at it from there. And then just to finish out the timeline, for about a year, we were working with smaller doctors' offices, private practice surgeons. I mentioned we have a tech-enabled service, which I think is important to mention because one of the challenges is, as a startup, how do you do that low lift, low risk offering without generating revenue? And that's kind of a no-no.
That's the old catch-22.
Mm-hmm. So we generated some revenue by having a services aspect to the business where we could generate that on our own. Yeah. And then over the last year, we have really started to transition into developing relationships with health systems.
Yeah, and you're starting at the hospital, like really kind of focused at one hospital within the system, and then the next step is like across the. Yeah, how many hospitals does UT Health have? 15, 20?
Something, and there's depends how you define it, because the different areas have different organizations within UT, right? So even within Houston, there's 4 or 5 different, right? You got MD Anderson, UT Houston, UTMB, all of that. So, but we're really focused, because you can't boil the ocean, and there's just so much to do in healthcare. Really focused on hospitals that do surgery, right? And we found that our process works best for tertiary care, complicated surgeries, patients that have a lot of medical comorbidities that are having
Yeah.
surgery.
Yep, which is where you were right in the middle of as an anesthesiologist. Right. What did it feel like when you were all ready for work this time of day and no one showed up, or like the surgery didn't happen, you couldn't do it? What was that?
Yeah, I mean, this is the reason why I decided to take the leap and do this, right?
Yeah.
Because, even when I was at places like Stanford, you think they have it all figured out, and for the most part they do, because they have so much resources, they can solve this problem. And then, I'd go to other places and the level of infrastructure was very limited. And it is extremely frustrating for everybody and a complete killer to the bottom line. If you've got a patient that needs a surgery, one of the most common ones we see is like a knee replacement, right? And you can imagine if you put yourself in the shoes of the patient, this is often a years-long journey. They've had arthritis for years. They've kind of gone through the whole medical complex, finally have reached this finish line, where they've kind of jumped through all the hoops of getting prior authorization and maybe knee injections and physical therapy. And then, there's some surprise, right? Like maybe they had an abnormal lab value or they had a heart condition that nobody caught. And anesthesiologists, one thing that we're really good at is we're like medical detectives, right? So you've got like 15 minutes to figure out what's going on with this patient and is it safe for me to, put them to sleep for surgery. And one of the hardest thing about that job is when you have to have that hard conversation of, hey, this isn't going to be safe. We can't do this.
Yeah.
And it's, really, really devastating for the patient, but then also, hospital surgeon, everybody is like, what do we do? Right? Like
There's an expense to that.
correct.
Yes. Yeah. This whole time, the age of AI has been unraveling. How has that impacted your journey?
Yeah, I mean, it's funny because I mentioned earlier I've been doing digital health stuff for about a decade now, and when I was on the academic side, I actually published a paper on some AI predictive tools around surgery back in 2019, 2018, and even then, AI, people were kind of curious about it, but this is obviously way before like ChatGPT came out. And so when we started Orchestra, we kind of always knew there would be an opportunity to utilize AI to streamline some of this stuff. But if I'm being honest, I don't think it really hit us until, when some of these newer models started coming out and we kept experimenting with them and starting to realize like, hey, this is actually pretty good, right? Like the efficacy here is we're actually capturing things that I would capture as a clinician. And once we saw that, just like everybody else, we kind of started implementing those tools into our system and our process, and it's it works.
Then how has it changed things, or how have the hospitals embraced it? Has it made it a little trickier to navigate through this big buzzword, or is it making things faster?
Yeah, I think, again, when we talk about hospitals, there are some, I would say there's a couple exceptions where, there's this, crazy sort of buildup where, everybody's kind of tagging onto these tools. But for most people, I mean, you gotta have a clear ROI, right? You gotta actually be able to present and understand like, hey, this looks really neat, but how is it actually going to impact our operations? How is it actually going to impact our patient care? I mentioned earlier, we have those two levels of service. Some hospitals, health systems, clinics have been really interested in those AI tools, but then others, say, we don't want to be responsible for looking at that, and then that allows us to layer in that tech-enabled service so that we can actually take those things to the finish line.
Yeah. Seems AI has created a ton of interest within the enterprise, and other large organizations has also created a lot of additional conversations. And it's like, versus just before, it's like, okay, we're buying software, here's what it does. Now there's this big idea people are grappling with of AI and what it is, and a lot, more people care and jump in. So it it's I'm not sure what the net effect is.
Yeah, I think, one of we'd be remiss not to talk about this at Health Supernova, but, as these AI tools are rolling out, I think one of the biggest questions I have is, like, I know a lot of doctors, right? I have my medical school classmates. I talk to doctors that are not doing anything in startups or digital health. These are people that, they're great clinicians. They show up to work and they do a great job. Their perception of AI is is what's going on like 2 years ago.
Yeah.
Right. And like when we show them some of our tools, it's like, oh my gosh, like where did this come from? Right. And I think the point is, how are clinicians, how are physicians and other healthcare workers going to interact with this software? Because I will say, from my personal experience, there is a lot of maintenance and there's actually a learning curve to be able to extract the value out of AI. It's not like you just click a button and it works, right? Yeah. Which I think a lot of healthcare organizations are going to realize this, that if you just throw a chat box at a clinician, they're not going to be able to interact with it in the same way as, somebody that's been using these tools for years, right? So I don't know. We'll see. I think it'll be very interesting because potentially some of these rollouts, you might start to hear some, negative feedback from physicians. It's just like, hey, this doesn't work. And it's like, well, because physicians aren't prompt engineers, right? They don't know how to interact with AI and get that value out of it. So as a startup, I think that's part of the challenge is you've got to do that prep work for them in order to make the context be valid.
Only time will tell. Only time will tell. Let's talk about fundraising for a second, and then we'll turn it over to the audience.
Sure.
For questions. So give us a summary on your fundraising history, and we'll dive into some lessons learned from there.
Yeah, no, I mean, this is, it's a great topic. It's kind of sometimes a dirty topic, like, looking under the hood and understanding.
It's a dirty topic. We have a dirty podcast.
Yeah, exactly. Well, what I mean by that is, this is why don't more physicians quit their jobs and do a digital health startup, right? And I'll tell you, like, from my personal experience, we went 10 months where we were bootstrapped. Right. And I will say mentally, psychologically, that was extremely challenging, right? Because, I think there's a certain income level that you sort of anticipate as a doctor, and then you go off and do something else, and there's an opportunity cost, right? But getting to your question, we really wanted to validate the company and the product before we went out and capitalized the business.
Pay the price for the dream. That's what I call that.
Exactly. So about a year and a half ago, maybe almost 2 years ago now, we did a pre-seed round. Yep. Right. We did that on Safes. Capital Factory was very instrumental into helping us and making that happen.
Got it.
So obviously going to put that plug in.
We raised a couple million, right?
It was 1.6, 1.7. Yeah. And that's, I think, at the time, it felt amazing, right? It's like, okay, we raised some money. We're actually going to be able to do some stuff. Yeah. And, one of the things as an entrepreneur, it's like, oh man, like, people are expensive, right? So
people are expensive. That lifestyle you get used to.
So that's kept us afloat. That obviously helped us develop the product and get some of these relationships, like with UT. Yeah. And we are now actually in the middle of closing our seed round.
Nice.
So any investors out there interested in what we're doing, that can be helpful. So
probably here at Health Supernova, I might be pulling some over to you. So you brought it up. Talk us through how you worked with Capital Factory for those folks out there who might wonder how they could use us as a platform to raise for their venture.
Yeah. So this theme has kind of come up a couple of times, but Texas. I'm kind of Texas through and through. Born and raised right here in Central Texas. Came back, all of my family's here, and as someone that spent time in Silicon Valley and Stanford and that culture, when I came back, I was really wanting to plug into that ecosystem, that environment. And for me, that's Capital Factory for sure, right? Based in Austin, connected with investors across the country, all of that, right? So what I've always said is, you get out of the relationship what you put into it, right? And obviously, Capital Factory is a big ecosystem. And even today, Health Supernova is a really good example, right? Because of our relationship, we talked and we set this up. So I think as a startup founder, potential entrepreneur, being able to tap into these types of resources, being able to plug in with people that know other people, it's sort of it just built on itself, right?
Yeah.
Because you can't do this by yourself.
Yeah, and we can't do it without a great founding team like you and Austin. And I think it's at the end of the day, we were talking for that 10 months of bootstrapping. I think I knew you is really how I was getting to know you and saw you develop it, and you had this mentality of really kind of getting some stuff done and building before you just go out and raise money, which we really value, and I really value at Capital Factory, and I think a lot of us on the team do. And then, I think by the time it was time to reach out, it was a matter of sending an email, making an introduction, and they. I forget who's the investor. Can you
our lead investor. I was actually just thinking I should throw them a plug too, so I will. But you guys actually made the intro. It was New Age Capital. And they have been amazing investors and partners. They helped us.
Where's New Age out of?
They're partly in Atlanta, partly in Dallas.
Nice.
And they've been awesome to work with. And some of our other investors, Looking Glass, it's a smaller firm in New York, and then Opal Ventures. But we've been incredibly lucky because, just so many variables in running a startup, right? But who your investors are, they're like partners. They're like relationships that you want to develop, and they can be incredibly helpful and beneficial, or maybe not so much, right? And thankfully, all of our investors have been really, really helpful in guiding us through the next stages of our company as we get a little bit bigger.
Yep. Well, it's been great watching you grow, and I definitely describe Orchestra as a textbook Capital Factory company, and met you at an event we hosted. Saw you bootstrap the company.
Yeah, I think we met at a Cup of Capital, probably 3 years ago.
We met at the Professional Athlete Angel Academy.
That's right.
And I remember meeting you because we had a whole bunch of professional athletes in, and we were teaching them how to get involved in the startup community. And Stu was there, and Stu had a cool startup. I'm like, oh, this is the guy I need to talk to.
Yeah.
In the back of the room. And by the way, what's it like having a brother that was in the NFL?
That was an experience.
Yeah.
He's retired now, so.
That's right. I know. I think he was retiring right when he was coming to that event.
Right.
So. Awesome. That was a great outcome of that event we did. Payne Matistic's out there. Hopefully he'll listen to this.
That's right.
Former Dream Teamer. And but then we introduced you to your lead investor. We participated in that round. Now you're here on the podcast. So final one of the cycle. Now we'll just take it to the next one. Next time you're on the podcast, hopefully we'll help you raise $100 million or something wild like that. So we'll see.
That's the goal. We'll get there.
Yep, we'll get there. All right, who has a question for Stu? Right in the back, and then Aaron's going to hand you a little microphone just for the podcast, and feel free to introduce yourself or not.
I'm Ian Wentners too. Just curious to understand what your primary success metrics include. So is it really around patient experience and patient satisfaction? Is it around operational efficiency in terms of reducing costs for healthcare resource utilization? Or is it maybe more around safety reduction in the errors, or all the above? It's hard to meet all those things, but what's your value prop as you introduce your service or your product?
Yeah, I mean, that's the question, right? For any health system and what we care deeply about as well. I think top of the list is achieving efficiency while maintaining safety, right? So the way we measure that, frankly, I think this is somewhat of a rudimentary tool, but every health system measures, what they call cancellations of surgery, right? The reason I say that's rudimentary, and this starts to immediately get into the weeds, but if there's a surgery tomorrow and you cancel it today, does that really move the needle, right? And the term for any OR manager, really what we care about is called block utilization, right? Where, we've got 10 hours of prime time operating room time. As a hospital administrator, you want those 10 hours to be going the full time, right? And if you have to cancel, and the term I actually prefer is a late reschedule, if you have to move that surgery at any time, typically within 7 to 10 days of the scheduled date, you're very unlikely to be able to fill that spot, right? So this is why time and being able to understand the context early is so important, because if you can sort of predict and figure that out before that 7 to 10 day mark, you can maintain the block utilization, right? So we measure that. We do, of course, measure surgeon, clinician, patient satisfaction, and then costs, right? I kind of hinted at this, but many, if not most hospitals today are still running all of their surgery operations with just an army of people, right? Call center, massive, I've seen entire buildings dedicated just to, running pre-op, where they do labs and EKGs and phone calls and all this stuff, right? And, I personally don't pitch, reducing staff, right? Like, that's a decision for the health system if they want to reallocate and, have people working top of license. But what we do measure, and there is some assumptions we make in order to come up with these numbers, but like just manual labor reduction, right? So we think we can reduce the amount of phone calls, manual intake forms, that manual chart review effort by 60-70%, right? So, and then what you do with that savings is kind of up to the health system, right? Maybe they can keep utilizing those staff and go deeper with patients and actually focus on, better support, or maybe they can actually have those people do more, hands-on patient care.
Awesome.
My name is Michael Trevino with Jumpseat Research. So Jumpseat is working with the Army to test battlefield technology. And this question is around trust. So the way a lot of times the military does it is they just kind of throw something in the field for a while, and then they experience a tech refresh without that technology ever being trusted. How is the medical space getting ahead of that, staying on the innovative edge, and building trust with relevant technology?
Yeah, I mean, with my background, I think we want technologies to be validated before we test them on patients, right? And I think that's kind of my interpretation of the question. And I think certainly a lot of these digital health technologies that are coming out, they should be validated, right? And I think part of that is having academic partners like UT Health, for example. But a lot of this stuff, we need to be able to understand it. Now, the other side of the coin, though, is sometimes that can be slow, right? And we could potentially go through this like years-long development process. Meanwhile, we all, just intrinsically see the value in some of this stuff. So there's a balance there, right? You don't want to just experiment and run this stuff out and potentially harm people, but you also want to deliver the value. So I think the way we've handled that is just make everything supervised, right? So we don't have any software tools actually making decisions. We review everything. We're staying within the confines of, the FDA and things like that, right? So
It's just great to see the startup community tackling hard problems. And, 10 years ago, we were just building apps and stuff that if things went wrong, it didn't kill people. And, now we're helping defense tech and health tech and stuff that's pretty serious, but you got to do it. And I'm just glad we're stepping up and building this stuff. Maybe one or two more questions. We go here and then in the back.
Hey, my name's Paul. I'm with Gemini Software Company. So you said physicians aren't prompt engineers. I recall that very specifically. And I'm wondering, is it because they're very resistant to the technology? You said they're behind a couple of years, right? Or is there another opportunity here? Do you want someone to be a prompt engineer? And then the example I make in my mind was, RNs these days are given a lot more power.
Yeah.
I could see them becoming kind of your primary clinicians. They're low cost. They're probably more willing to the technology, and probably a better companion to the AI coming up for a lot of these things. I don't know if you're taking on that. It's
Hot take.
Man, really great point. I love having these kinds of discussions, right? Because it's just fun, right? But I think there's definitely some truth to what you're saying. Maybe there is an opportunity there, right? I have some close friends that are in the medical education innovation space, and certainly there's going to be a shift in how clinicians are trained, right? Like it might actually end up being part of the education process, right? Where it's like, hey, you've got to learn how to interact with these tools. And I think there's going to be some key differences, but this is pretty similar actually to the EHR rollouts, right? In 2008 to 2012, where, a lot of hospitals were still on paper or some rudimentary tools, and then they all shifted to, these big electronic medical record systems in a pretty short period of time. And I was a medical student around that time, right? And as a geriatric millennial, I was able to interact with those tools pretty easily. But then I would watch my superiors, older physicians, and it was very painful to watch, right? But I also think, just like with any new technology, it's kind of a bell curve, right? You got these early adopters. I remember one of the hospitals I worked at as a medical student, Epic rollout was a new thing. And, you'd go in one clinic and you'd have a doctor that had already completely figured it out, right? They had these automated phrases, they had templates, they were utilizing all the tools. And then you'd go to the next clinic and, the doctor is one finger punch. This is, 2 hours to write a note, right? And I'm sure we're going to see that with AI, right? Some doctors have been utilizing Chat GPT since the early days, and they're paying for it, and have kind of maybe figured out how to add some HIPAA compliant stuff to their model, and they use it almost like a co-pilot. And then others are just what is this, right? So, but I think the bottom line is, in order for AI to really reach an inflection point in healthcare, you have to make it so that it can be utilized by the majority. And, of course, there's some physicians out there that, and maybe rightfully so, are hey, this is actually kind of scary. It's doing what I do, right? So, and that's a whole nother topic. We had some really early success partnering with just independent, smaller decision makers, like surgeons that kind of manage their own practices. Early days, we really felt like there was going to be just such an obvious opportunity to partner with surgery centers, actually. And that turned out to be really challenging, actually, because surgery centers, they're typically lower risk, more focus on efficiency. And our process and our product has really been more tailored to complex situations. So think like a patient that's taking 20 medications. All of these medications need to be adjusted before surgery, right? So our tech, we can detect those meds and we can automate, hey, this is what you do, and then we make sure and track that those things actually get done, right? But if you're having surgery at a surgery center, it's you're healthy, right? So there wasn't quite as much ROI. So we kind of made that adjustment to where we started to move more into health systems, really focusing on having deeper conversations with hospitals that do more complicated surgery. So that was kind of our journey in figuring out, what's the right go-to-market, who are the right customers and partners to be talking to.
Question. And one more right here, and we'll wrap it up.
Everybody seems to be realizing the potential that AI has to solve almost every problem, especially in healthcare. From the innovators, entrepreneurs, to the publicly traded companies. So how do you stay focused on a niche when you have all these players trying to have robust solutions? How much time do you think you have to really develop this space before someone's doing it as a part of a larger solution?
Yeah, I mean, that is probably, from a business perspective, that might be the most important startup AI question, right? And I've been going to a bunch of meetups around Austin, and everybody's asking, like, what's the defensibility? Is this just going to be distribution, right? Like the biggest people are just going to click a button and they're going to beat out everybody else. I think it's too early to call it, right? I think we don't quite know. I will say personally, what I have seen, and this is something I've been kind of thinking about. I utilize a lot of software tools to run our startup, right? Like email, sales, CRM, all this stuff. All of them have deployed AI in the last 6 months to a year, right? And of course, I've experimented with them, or I click a button and it's like, write my email. It's awful, right? Honestly, like it reads my emails and produces something, and I was like, this is not the best, and then I have to spend more time like editing it. And I've been wondering why that is. I do believe there is an aspect to smartly integrating the models at the right place at the right time, and then pre-training them to actually make them do the thing that you really actually want it to do, right? And that is something we have personally experienced. If I, for our use case, if there was a chat box and I said, hey, prep this patient for surgery, it's going to come up with just wild, landscape of things that's not going to be really contained or focused or repeatable. And obviously we've spent a lot of time, doing that prompting and that training and adding additional data to make it, actually do the things that we care about, right? And I think large organizations maybe are going to sort of underappreciate that level of intricacy, for a particular use case, right? So, one thing that's coming down the pipeline for sure is that every electronic medical record is going to have, some sort of chart summarization or chart box, right? And, obviously I'm somewhat biased in saying this, but I think those tools are going to be more rudimentary and probably not going to work as well as something that's, focused on a specific use case.
Awesome. Well, how about y'all join me in thanking Stu for coming on the Austinpreneur podcast. Thanks for listening to this episode of Austinpreneur. Don't forget to check out capitalfactory.com to learn more about us and join our community. If you have thoughts about the show or ideas on how we can work together, reach out to me directly via email, nickspiller@capitalfactory.com. Shout out to the Capital Factory Dream Team for making this podcast possible, and special thanks to Aaron Handworker, who masterfully recorded and edited the show. Come back next week for a whole new episode.